properly caffeinated or on your way there, and ready for another day of TV together. We're thrilled to be hosting this next conversation with the cast and creatives of NBC's New Amsterdam and the American Heart Association. This is such an important time to be talking about healthcare, community, and how those two intersect. And we can't think of a show more equipped to be taking that conversation head on. Before we get started, remember to use the hashtag TV Together as you watch along this weekend, and tweet, Instagram, Facebook us at ATX Festival. And of course, don't forget to catch up on New Amsterdam on the NBC website and app. With that, I'm going to go ahead and bring on our panelists, starting with Peter Horton, executive producer in New Amsterdam, who will also be moderating our conversation today. Hi, Peter.
Hi, how are you, Jennifer?
Next is David Foster, executive producer and writer.
Thanks, Jennifer.
Next is Erica Green Swafford, producer and writer.
Hello.
And then Ryan Eggold, actor, and Dr. Max Goodwin.
Hey.
Jocko Sims is an actor, Dr. Floyd Reynolds.
Hey there.
Hi. And then we have Dr. Regina Benjamin, 18th U.S. Surgeon General and the American Heart Association Board of Directors member. Hi, Dr. Benjamin.
Hi, everyone.
Hi. All right, I'll let you take it from here, Peter. Enjoy the panel.
Fantastic. First of all, I just want to let everybody know that Dr. Benjamin loves our show, and we're thrilled about that. So
I do.
Not only here to be part of the panel, she loves our show. Welcome, everybody. I guess I want to start by saying we're so sorry we're not there in the usual manner, which all of us have been there in different incarnations, which is so much fun to be there with you in the room, see your faces, hear your reactions, be able to hear your questions. And there's usually a real intimacy that comes from that. And so we wish we could be there with you like that. But given the fact that we aren't, we're going to try and make this as intimate and as casual and fun and similar to that as we possibly can. So everyone's going to throw thoughts in, and we're going to talk amongst ourselves, and going to have a lot of fun. I'm going to set this up a little bit by starting with the fact that I, like a lot of you, grew up in a time of stakes. It was the Vietnam War, it was the Cold War. There was all the assassinations, Watergate, all that sort of a thing. And storytelling in that time really reflected that reality. I mean, we had Apocalypse Now, we had All the President's Men, China Syndrome, Platoon, and storytellers needed to speak to that moment in time because the stakes were high. And then starting in the 80s, we kind of went through a period of time of calm, and we as storytellers really became primarily entertainers and people who could transport you into other worlds. But now we're back in a time of real stakes, and we happen to be a show uniquely situated for this particular situation. New Amsterdam, as you probably know, is based on Bellevue Hospital, which is the epicenter of the COVID outbreak. And so we are telling stories from the very epicenter of, at least coming up this year, telling stories from the very epicenter of the situation we find ourselves in. And so one of the things we're going to talk about is how do we change? How do we adjust to that reality now as storytellers, as actors? And does it, what's our relationship to it? Does fiction help? Is it just entertainment, or is there an added responsibility because of the stakes? And that's where Dr. Benjamin can give us some insight too, in terms of, from her perspective, being in the real world, is it really helpful? So we're going to get to all those questions. And so I think what I'll do, I'm going to start with you, David. David Foster is our resident doctor on our writing staff. He's not only one of the executive producers, he actually is a real doctor. He saves us from ourselves constantly when we might be coming up with stories that make absolutely no sense medically, or if we have stories that make sense, he helps us make sure we're being accurate with them. And so I want to ask you, I have a kind of a twofold question. first of all, I would love to hear at some point what it's like to be a doctor at this time in the world of fiction. I mean, you have a world where you have the credentials to be in the midst of it, in the middle of it, and yet you're either blessedly or frustratingly in the world of fiction around this. And is that hard for you? Is that a good thing? Is it something that what's your take on that? How do you feel about that?
Yeah, it's interesting. Thanks, Peter. It's an interesting time for doctors in medicine as a general group, and so many people in the healthcare field are on the front lines of what's really going on and fighting this coronavirus. And so many of the people I trained with are running ICUs and doing missions to other countries to try and help people get up to speed on their care for the coronavirus and sharing best practices with each other. And it's in part for many people an exciting time. There's big things happening, and it's scary times. I think everybody's concerned for their health, and it's also, concern for the health of everyone. Like, how can we stop this and help the safety and health of all of the people of the world. So for me, my part in this is to write interesting television stories, which is a different job than many doctors have. In moments of grandeur, I suppose I look longingly at the people running ICUs and think, wow, those are some exciting times to be on the front lines of the battle of your generation. But then I'm thinking more sort of sane moments. Boy, those people are really brave and are putting themselves out there every day. And I'm glad they're doing it, and I'm glad they're trained to do it. I certainly am not. I certainly would be a disaster if I was thrust into that situation.
Unlike Ryan or Jocko, who could help because they play doctors on television and have real abilities in those areas. So anyway, that's just good for us all.
Can I add to that a little bit?
Yes, please.
Okay. So I'm a family physician, and I have a clinic in a little small rural town in Viola Battery, Alabama. But I left that to become the United States Surgeon General. And that was a really hard decision because I had patients that I had been the only doctor in town for 22 years. But when I took on the role of the Surgeon General, I became America's doctor with 350 million people as my patients. So when you write a story, you really are getting these messages out to people and getting them out in a way that as individual doctors, we can't do, and getting that information. And there's a hunger for this type of information now around science and the things that you're hearing right now. So you really are always a doctor. Once a doctor, always a doctor.
Mm. That's so interesting. It's so great to hear that from you, because we create these stories and we perform them and we edit them and direct them and put them out there and never really know what the impact is. So from your perspective, what is it that helps out there in terms of our messages when they come out? Like, for example, the two episodes we're going to talk about, one of them is that one that David wrote about the fact that African-American men have a real epidemic of high blood pressure. And you're with the American Heart Association. How does it help to have us do a story about that, and from your perspective in a real way?
It really does. I mean, you reach millions of people every week with an episode, and then when it reruns again, you reach millions again. As an individual physician, I can tell the patients this. As public health people, we sit and tell you about the social determinants of health. We talk about the health disparities. But when you look at an episode, people relate to it, and they can identify with it, and they can tell their friends about that storyline the next day and have a conversation about it. And that takes it to a different level that we in healthcare try to do, but you're able to do it in a different way.
That's really encouraging, right, guys?
I am a fan, obviously. But
So let me ask Erica and David this question, and then I want to get to Ryan and Jocko. But so that's the reality we're in. We're in this world now of COVID, which it's a different world than the last time we were writing stories for our show or performing stories for our show. It's a different world, and we've been telling our stories from the context of social stability. Now the fabric in our society has a rupture. It's unpredictable. It's unstable. It used to be the world our patients were coming from was stable, but they were unstable, and we were trying to fix them. Now the world they're coming from is unstable. How does that affect how we approach, or how you guys want to approach stories? How does that change it for us going forward this next year? Erica, do you want to start?
I still think that even though the world is completely unstable for all of us, that instability is felt differently by different groups of people. And so our storytelling can still shed light for a lot of people on how other people are dealing with the situations that we are talking about in our storytelling. Just because a person lives in Manhattan doesn't mean that their experience of this COVID nightmare is the same as someone living in Corona, Queens. And so there are still ways that we can say, we are all in this together, but we are all dealing with this in very different ways because the very fabric of our society is built on a notion of instability. So I think that is one way that you can sort of talk to those things.
So how do we unpack that a little bit more? So there was an innate instability in certain parts of our country to begin with,
right,
that now is felt throughout our culture.
Mm-hmm.
It's kind of a great equalizer in that sense, right? So how do those fit together for us?
I don't know if it's a great equalizer so much as it is an experience that we are all feeling. And some of us are going to feel it deeper and more magnified in ways that others are not going to experience this same great colossal issue that we are facing. So especially like within healthcare, those outcomes of people who are going through COVID-19 as a disease, as a virus. Some people will be able to experience it, do the 14 days in their home and be fine. There are people that are living on the street. There are people that are living in households where there is no way to quarantine from somebody else. So you can tell their story. You can talk about frontline workers who are continually being exposed by this. And those outcomes for African Americans, for people who are Latino, who already have compounding issues, this is going to make them feel it worse. So even though we are equally experiencing something grave, there are still going to be people that are going to feel it even more so because of the disparate nature of the way things are happening in our country. Whether it's, when we did the thing about racism, and the young boy was clinically diagnosed with racism, and that was what was that was his underlying factor. If you are already coming out of the gate with that, and then you put this on top of it, it's a turducken of madness. And so some people are going to be getting chicken, and then some people are going to be getting chicken, turkey, and duck at the same time.
Well, that's such a good point. In a strange way, I mean, we've had discussions about this both in public and otherwise, how in some ways this whole pandemic has caused our divisions to be greater between the rich and the poor, how you go through this as a rich person versus a poor person, how you go through this as an older person versus a younger person. I don't know about you guys, in my household and around it, all these discussions about, okay, who's at risk and to what degree do we put the economy at risk to protect this one group of people versus, I mean, in a way, it seems to be as it's gathering us together on one level where people are trying to help each other and reaching out to each other, and certainly anecdotally, and even when you look at the way in which we all did kind of isolate pretty well as a country initially, it's also now revealing our divisions politically and socioeconomically and all those kinds of ways. And I saw, Dr. Benjamin, I saw you nodding your head as Erica was talking. Do you want to add to that?
There's so much to add to that. There's so much. She touched on the health disparities, particularly. When we first started talking about COVID, we told people that elderly people would come, were at risk, and people with underlying conditions. And we were thinking about people with cancer and, bedridden. But we really weren't thinking about people with high blood pressure, diabetes, and just obesity and things that are chronic conditions. So once we started seeing African Americans, Native Americans, and Hispanics starting to come in, we weren't surprised. But what we were surprised about was the fact that they were coming in sicker and they were dying much faster. And that was a total shock. So the American Heart Association also noticed that people with underlying cardiac arrhythmias and cardiovascular disease were doing worse. So we started a $2.5 million rapid research fund to try to figure out why. People don't even know they have a cardiac arrhythmia. Many people don't know their blood pressure is high, and they may have pre-diabetes and don't know it, and yet they're at risk and don't realize it. So we're seeing these terrible numbers. But I don't want you to think it is just because of our race. It is because of the social determinants of health. And that is what we're having to deal with as a society. We have research to show that your financial health is directly related to your physical health, your air quality, all of those things really, really matter. And your zip code is a better predictor of your health outcomes than your genetic code.
Wow. Jocko, let's talk about you and your situation. Coming back to the show now, you're the head of the cardiothoracic portion of our hospital, and you have been working with various cardio surgeons to learn your craft, to learn what you're supposed to be doing. And you've been playing for 2 years, a guy who's, like I said, dealing with cases as they come. Now, since we last saw you, and Lord knows when and if we're going to see you again, Amsterdam. But assuming sometime, I mean, even no matter where you end up as your character, how's it changed for you? How do you are you viewing it differently at all? Are you thinking about how he would, what his inner life and perspective is, having gone through this as a cardiothoracic surgeon? How does it change your physicality? How does it change how you feel about him, if at all?
Yeah, it's interesting in the sense that, well, first of all, as you mentioned, I'm not sure what the future for Dr. Reynolds would be. And for those of you who have watched the show and have been keeping up, my character moved to San Francisco to be with his fiance who got a job offer out there. And before the season ended, season 2, we're going to wrap up the whole thing, all the questions, whether or not my character was going to be gone for good, or is going to be, talks of a spinoff, or he was going to come and leave and maybe come back. We're going to wrap that up by April, perhaps. But now we're going to have to push that into season 3 and close it up. But hypothetically, I would say if Dr. Reynolds were to stick around, I mean, there's all sorts of things that I could bring to the character. Maybe some of us have known someone who has been directly affected, or even what comes to mind is my own personal health. Just being a Black male, or being a person that comes from a family that has, a history of high blood pressure and diabetes and whatnot. And full transparency, I checked my blood pressure today and it was a bit high, and that's scary. So being able to bring these sort of real life situations into the character and into the story. I mean, there's definitely a lot there.
Yeah. Ryan,
Sure.
same question is going to come to you, but I want to add one piece to it, which is about leadership. Since you're the head of New Amsterdam and have a very, very distinct and solid sense of leadership for that place. And there seems to be quite a bit of chaos and confusion in our national leadership around COVID. It's infused with a blaming, caustic, sort of divisive tone. And I'd love you to talk a little bit about, since you inhabit this character.
We're not inhibited.
Who is the leader of the largest hospital in America? It's basically the size of a city. How are you feeling about approaching Max as the leader of this hospital in the context of the national leadership that you and I guess he has experienced? How does that impact you or affect you?
Yeah, I think to your question, Peter, that there is an opportunity to talk about leadership, and I think one of the areas where we've grown in the show, and one of the areas where we've struggled and sort of learned the most, one of them is not making Max's solutions to these large, complicated problems, issues, too easily afforded, or too simple, overly simplified. Well, I'll just I'll give this guy a way to check blood pressure in his barbershop, and then everything will be, it's like the opportunity to discuss solutions in a realistic way, and first off, even just transparency about the issue. I mean, one thing that's nice about, not to get political, one thing that's nice about Cuomo's leadership in New York, for instance, is that he just says this is what's happening. First and foremost, this is the problem, these are the facts, these are the issues. Whereas the national leadership, perhaps less so. But I think that, there is the opportunity with this character, with this story, to provide a template, an example of what leadership, good leadership might look like, and what the best way to sort of tackle issues and problems are that can help everyone.
Yeah, the politicization of a pandemic is an interesting thing for Max to consider, I would think.
Certainly. Yeah.
Because David or Ryan, what do you think his take would be on that?
Max's take on the politicization of this pandemic. I mean, I think Max would try to cut right through all the BS and all the crap and say, how do I help people? How do we get care to people? Which is sort of the opposite of what we've seen on the national stage. But forget how do I stay medical director, or how does this benefit me, or how do we help people has always been David Schulner's and your guys and Max's motto for this show. And I think that the political stuff and all that is so often a barrier and a hindrance and a way to hide from doing the work that needs to be done, perhaps.
I would also say that Max would say, how can I save people's lives? And how can I save the most lives and the lives of their family members? And he would go beyond that to say that, and again, cut through all of that stuff.
Right.
Just turning the prism a little bit about it, just is one of the things that, as Ryan, that we've talked a lot about with Max is unintended consequences. In that, even the best of intention policies sometimes have people or situations that fall through the cracks. And one of the things that's really interesting in this time of COVID is people still get sick with other things, and that the hospital still needs to run in a certain way to take care of heart attacks and traffic accidents and people who at home slipped down their stairs and broke their leg. Those things, more mundane things, happen too. And I was just reading in the New York Times a fascinating article about what's happened as one of the consequences of the COVID restrictions at hospitals, that we limit visitors. In fact, almost no visitors into the hospital, and what that does to patients who are coming in for other procedures like a liver transplant or something, and that now people are sort of being asked to go it alone without their usual supports, and that this is what becomes an obstacle because of the things we need to do to keep everybody safe from COVID, becomes an obstacle to people getting care in other places that they need care. And how do we address that? And how does Max respond to those situations? And it's the interconnectedness of all of the hospital's functions and roles, and the different people who come to the hospital. It's a fascinating sort of web and world that we're able to portray on television.
So
Yeah.
David, while I would also include, while we're interested in heart disease at the American Heart Association, all of the risk factors for heart disease, we talked about those social determinants, the stress. And so you can go into the mental health issues, and that is just as bad. But we're seeing a lot more telemedicine. And so how can you incorporate that teleconferencing and in the ER, wherever it is, but it's a reality in healthcare right now. The other thing I'd say about this particular conversation is empathy. I hope on the other side, when we come out of this, we talk about people who our economy shut down. People don't know where their next paycheck is coming from. If they have kids, they do have to go to work. What are they going to do for daycare, and the amount of stress that they're going through? Well, we have some populations that have been dealing with this every single day for years, and that's their reality. And so I hope people will understand that and not be so quick to say, well, why don't they just get a job? Why are they just lazy? Why aren't they doing these things? And have a little bit more empathy.
Oh my God, yeah, it's so important, and especially given the circumstances now, because those people who were vulnerable to begin with are even more vulnerable now.
Correct.
David, I love the idea, because it feels like it'd be such a New Amsterdam story of here patients coming in, and we haven't been able to allow visitors. That's a Max softball or fly ball right field. I mean, for him to try and solve that and figure that out, because
someone have to hold the hand of a person that's dying and show that face time with their loved one at the end. I mean, that's got to be there. So,
well, yeah, that's the other thing, is what you doctors have experienced in our fantasy world that's now part of the reality world of having to walk to. I mean, we've all seen these images of them having to go to a person who's passing on or dying with a FaceTime, with a phone, to FaceTime the relatives, so the relatives can say goodbye to them over FaceTime. With a doctor who's fully PPE'd and a patient who's full of all sorts of equipment. I mean, it's just such a tragic reality that everyone has been experiencing since we've been off the air. And so how is that going to impact?
And like I said, I'm a big fan, so I'm going to give you some other ideas. One is
good.
About
we steal from the best.
In addition to mental health, we also have the issues of domestic violence and child abuse. And so that's a real issue. One of the organizations I'm a part of, we want to make sure that people know how to recognize that, and that kids who are at home with their abusers have someplace, an outlet to go, and that we pay attention to that.
Definitely. Let's talk really quickly about the 2 episodes that everyone was able to see before this panel. One was written by David Foster, like I say, about Max discovering, just through a pickup basketball game, discovering a reality that African American men have higher blood pressure, or there's an epidemic of it, and it turns into a case for the show. Or Erica, your episode, which is 7 women from Alabama who, in order to who all have underlying health issues, in order to get any kind of care, come to New Amsterdam and have to crash the van to get the help they need. So in both cases, there's 2 things that occur to me. One is everybody that comes to our hospital has underlying conditions. So this outbreak, this pandemic, is dangerous to every patient we have. How would you guys tell your stories differently if you had to tell them in this environment? Who wants to go first?
Happy to jump in. I think many of the specifics are different. Kenny would be wearing a mask while he was cutting hair. Probably wouldn't have a group of 10 people sitting around giving him a hard time while he's cutting hair. But Max probably wouldn't just join into a pickup basketball game with a group of people he didn't know. But I think many of the central themes that the show dealt with, I think, continue to be relevant and true. If we wrote that episode this year, the idea of recruiting community leaders as important spokespeople to get out public health messages, and also to help to recruit people to actually maybe follow through on some of these measures. I think that's still an important measure. Hypertension certainly has increased in importance in the community. In the 80 million Americans who suffer from hypertension, and certainly still the notion of the barbershop as a community center. There are programs now using hair salons and barbershops as important touchstones for contact tracing with COVID. So these sort of themes continue to be central.
And if I can jump in for a second, David, I'm sorry, Erica, but you mentioned the basketball. Of course, Max would not be able to, in this city, pick up a game of basketball because they've taken down all the goals. Every goal, I ride my bike now everywhere, every single goal. I don't know how they did this in such a quick time, but they've taken out off the rim. And I Googled it to see why initially. And obviously they just didn't want people gathering during this time. I thought it was for a different reason at first, and then I calmed down. They're just keeping everybody safe.
Erica, go ahead.
No, go ahead.
Erica, how would you tell your story differently?
Man, traveling en masse, that number of hours to the epicenter of COVID, they would probably shy away from having any sort of organized convention or anything within the city.
Would they even come into the hospital at that point? They'd be staying away.
I don't know. I don't know if they would have. She would have come up with that as a plan. I know that they would have personally been touched in their lives. I have been touched. I have extended family members that have now passed away from COVID because of pre-existing conditions. Right. So that would be in the back of my mind. I think they probably would be they were already angry and frustrated. And I see that there's a lot more mobilization because there's been time for self-reflection. There has been a lot of, people having to think about their lives, even as they go about how to navigate these COVID waters, to get more care locally, see if there's a way to get more of those dollars to become, the righteous right hand that she wanted to be for them in that moment. Messaging, whether or not it's becoming more political, being more active within your church group, to expand to make sure that people are getting covered appropriately with Medicaid and Medicare. And, I think those same issues of looking out for being your sister's keeper would still play out. Whether or not it would happen in New York, I'm not so sure, but I think there would be more of an impetus to amplify hey, we need help here, and I'm not happy with what's happening right now and the way that things are playing out for us. So,
fantastic. Well, we're getting low on time, so I have 3 more quick questions. I'm going to start with Jocko. Being a celebrity, you have a microphone in a way that most people don't. So you both have been able to do PSAs. I think, for both of you done for one for Bellevue. Jocko, I think you bought pizzas for the nurses at Bellevue on Nurses Appreciation Week. and a number of other things. Do you feel like you're making a difference doing these things, or do you feel like you're sticking your finger in a leaky dam? I mean, do you feel like it's having an impact?
That's a good question. I never always hope that, I reach one person at the very least, when we attempt to do things. But I don't know, it's been an eye-opening experience. I remember in the beginning, after New Amsterdam gave all of our PPE to the hospitals, I attempted to try to get some more things to the hospitals, some more gear. And it was